Hello, I'm Jeffrey Cummings. I'm the director of the Cleveland Clinic Lou Ruvo Center for Brain Health.
My name is Zaven Khachaturian. I'm the editor-in-chief of the Alzheimer's and Dementia, which is the journal of the Alzheimer's Association.
I am the Marge and Jean Sweeney Professor of Neurology here at the University of Kansas Medical Center.
Alzheimer's disease has an enormous impact on our society.
Alzheimer's disease has a tremendous impact on a lot of people, on the people who have the disease, on their families and friends, on the clinicians who care for these people, and on society at large. The major limitation for treatments in Alzheimer's disease is that we don't have anything that works as well as we need it to work. We have treatments that can slow the progression, and they do have a beneficial impact, but more effective treatments that can arrest the decline are urgently needed.
Alzheimer's disease is a very complicated illness. Diversifying our approach to Alzheimer's disease is very important.
So we need to think about the disease differently. We need to think about the disease as a complex disorder, come out with alternative strategies for therapy development.
It's important to consider all potential mechanisms that might underlie Alzheimer's disease, especially since it may turn out to be the case that Alzheimer's isn't one homogeneous entity and that there are actually multiple causes.
I think we need to expand our repertoire of targets for drug development. We should be looking for drugs that modify the disease by affecting amyloid or tau or neuronal survival. We should be looking at metabolic agents that assist the neurons in functioning more normally. We should be looking at transmitter agents that have an effect on cognition or on reducing behavioral symptoms of Alzheimer's disease.
Energy metabolism and mitochondrial deficits in Alzheimer's disease patients have been recognized for several decades, really going back to the 1980s.
Metabolic targets have become much more interesting in the recent past.
I think targeting metabolic defects for therapy development for Alzheimer's is a very promising line of research. There is substantial evidence that a metabolic disorder is a really important precursor to what's happening in the disease.
We know in the brains of Alzheimer's patients that there are issues with utilizing glucose, which raises the question of could an alternative energy source such as ketone bodies be used? I think it's a very reasonable approach to try and manipulate brain energy metabolism.
I think that there needs to be a bit more risk-taking in pharmaceutical companies in terms of innovation, innovative ideas. A lot of good ideas are coming from small biotech companies, small pharma that are not large. They're willing to take some of those scientific risks. So we need to encourage those.
New and more effective treatments for Alzheimer's disease are urgently needed.
We have to discover new therapies. We have to have better therapies than we have now. We have to proliferate the targets so that we have multiple types of therapies. We have to be able to individualize therapy and to guide therapy with biomarkers. There's so much left to be done, but we have to do it. We have to solve this problem. We can't let 100 million people be affected.